As Southeast Asia gears up for mass vaccinations, Singapore's Changi Airport says a dozen cargo logistics firms are ready to transport vaccines to the region. The group is the largest in Asia Pacific and is internationally certified to handle such pharmaceutical goods. Nisha Rahim reports.
These containers are typically used for transporting medicines and frozen food in the airplane cargo hold at a constant frosty temperature. And soon they could be doing that for thousands of vaccines vials, according to airport ground handler SETS. Instead of big freezers, dry ice is the cheapest way to cool down on the move. SETS says each container can hold up to 150 kilos of the substance to bring temperatures as low as negative 25 degrees. To give them another layer of protection, they can be stored in this $16.5 million sub-zero facility called Cool Port before leaving the airport to other countries. For those meant for Singapore, it could be up to companies like SFS Pharma to keep the cold chain unbroken. The global firm also uses dry ice and cool rooms to store and distribute pharmaceutical goods. It has its own set of smaller boxes to load onto vehicles for dispatch. Meantime, it wants to step up training of delivery drivers.
Some of the logistics companies are not very familiar with low temperature ranges like -20, how you precondition the material correctly to ensure it's constant negative 20 degrees Celsius. You have to have that technology, and you need to train the people how you manage if there's an alarm coming up to pre-warn you that, hey, the box is going to be out of range.
It's already got queries from drug companies working on vaccines to potentially deliver them worldwide. For hospitals, at least one private medical group says it has freezers to store vaccines that require around negative 20 degrees Celsius. Any lower, and it will be a challenge. A 14-member committee that includes experts and scientists was appointed by the Health Ministry last month to work out Singapore's vaccine strategy. The government has said there are no plans to immunize the entire population.